You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I'm here today with Misha Price, owner of Physicentrix in Montreal, Canada. And Misha actually is a neurobiologist by degree. He studied under one of the leading pain experts in history, Ronald Melzack. And he'll tell us a little bit about his experience with Dr. Melzack, as well as he does in his practice and how he helps chronic pain. So, Misha, can you tell us a little bit about yourself and your practice and what you do?
Yeah, of course. So, first of all, thanks for having me on the show, Dave. Pleasure to talk to you. My background is in neuroscience, studied at McGill. Like you mentioned, did some courses in the psychology of pain and found that super interesting. And then that kind of led me to open a physical therapy practice here in Montreal, where we primarily focus on orthopedic conditions, just helping people with, neck pain, shoulder pain, a lot of low back pain, knee pain. We do see a lot of, types of people that, are struggling just to find what really works for them. Because as you know, when we get into the areas of chronic pain and people that have been suffering a bit longer, it's not always easy to manage those cases. So we have a specific way that we kind of look at that gets better success. And the real reason why I started into that is just I really just like helping people. And I think that there are just other ways that people can find help that's based on the traditional way of just seeing your doctor and getting pills and injections and things that, why we're seeing don't really work and cause certain problems. So I think it's just cool to offer, other people hope and, better success to manage, the issues they're facing. And so they can go on and lead, more healthy lives.
That's great. Now, talking about the patients that you see who are in chronic pain, you mentioned they're looking for a different option. Can you tell us a little bit about your kind of common patient that you see with chronic pain and, what they've struggled with, what hasn't worked for them in the past, and then what you do that makes your practice a little bit different?
Yeah, of course. So I think, probably like most people go initially when they have a problem, they go to their doctor and the doctor usually prescribes medication or, tells them to rest a bit and hope it'll go away. As you know, Dave, most of those times don't work. And then, people start looking for options. And, in this day and age, they can jump on YouTube or they can jump on the internet. And sometimes that's a bit of a caveat because people don't really know how to properly manage their issues. And they'll usually just go down kind of a rabbit hole of finding things that kind of work short term, like massage therapy that, will give a short-term, benefit, but doesn't really fix the issue longer term. And then sometimes it's complicated too, because they'll be getting different, recommendations based on the different people they see, and it just adds to confusion. So, usually how we kind of approach those situations is, and what makes us a bit different is just having a process to better understand what's really going on when those people are at, the stage where it becomes a chronic problem, because the difficulty there is it's not always a one-to-one relationship. Generally when people have an issue, let's say an acute problem, it's much easier to manage that because the pain is in a direct function to the problem. Whereas when we get into situations like specifically lower back pain and chronic pain, There can be other factors going on, like psychosocial factors. There can be a mixed pain presentation. That being said, it's not always a one-to-one relationship between the types of feelings people are having to what the problem is. And so there's a specific way we have to manage that in terms of figuring out, what is the client beliefs in terms of, are they going to get better or not? What is the presentation of their symptoms? What is the actual type of pain they're experiencing? Are there any other psychosocial factors that we need to consider? And I think that, not a lot of people really take the time to understand what's really going on and figuring out how to properly manage that and come up with a plan that integrates different people in the process and different strategies that, I think a lot of people are being left in the wayside in terms of, just having, being giving medication or saying it's going to go away on its own or, trying to figure out exactly one main reason. And I think that's the complexity is there's not one main reason why these things are happening. And to just start with that approach, I think leads to much better success.
Well, it sounds like you do take quite a bit of time how much time do you spend in a typical kind of initial consultation with a patient?
So our process usually is, we try to slow down the process in terms of people making a decision, number one. So we have ways where, we'll schedule, let's say, an initial phone call and clients can call in and just have direct access to the therapist where we get to know kind of what's their goals for treatment, what's really going on, what success or not, lack of success they've had in the past. Then we'll usually, offer them maybe, an in-person visit where we can further that discussion in person. They can tour the clinic, and figure out a bit more about what their challenges are. We find that works just a bit better because, as we mentioned before, there's a lot of options out there, and sometimes people get confused in terms of what, are the real solutions to their issues and get to know us better. Which I think is a bit different than, it just going to the public system, right? Is you're pretty much a number and, you're being told what to do without you maybe being part of the process as well. So that's number one is we try to, for sure, slow down the process and figure out exactly, if we're a good fit for them, just as if they're a good fit for us. And then we'll usually schedule, an hour consultation to begin with where we'll review everything in a bit more detail, do, the proper testing we need to do, and figure out exactly what's going on. But that being said is that there's a certain framework where I think is a bit different for managing chronic pain in terms of, just listening a bit more, asking them the proper questions, to figure out exactly, again, what their beliefs are, what they think is going on, what we think is going on, and structure it that way so that, that initial, few visits are important in terms of managing, what the plan and the pathway forward is, and usually that leads to better success.
That is quite a bit different than your traditional kind of come in for a 15-20-minute visit you've never met or spoken to before. So it seems like you're getting pretty good outcomes with that process. Can you tell us a little bit about how you kind of became a pain expert and how you got into the world of chronic pain?
Yeah, of course. So as I mentioned before, just back on my degree in neuroscience, I was really intrigued by the whole association of pain, within the development of better understanding, how people are feeling pain and what's really going on there. It's quite fascinating that, before in the the research of Descartes and all that, they used to think it was just kind of like ringing a bell and then you'd feel pain, and it's not about that at all. Your brain's a very powerful organ that can, control even your sensation and has an effect on your perception of pain. And there's a psychological component, as we know now, just based on the current research. So that was number one, was really, really interesting. And what kind of led me down to doing what I do now is just realizing that I think there's a lot of people that just have unmet needs in terms of how the current healthcare system's set up, how those people are managed, how, for specifically chronic pain is managed. And I think there's a need to have a better understanding of how to treat those types of people and, come up with a strategy and a plan that, is getting us good results. And I think that's what motivates us to do our work.
And how did people with chronic pain, start finding you and hearing that what you do is a little bit different?
So I think just giving, educational seminars in the community, giving good service as well leads to, better referrals and creates, an exposure for us. But I think it's also just, by number one, just feeling like we're trying to give back to our community and offer, solid education and support for our clients and the people in the community.
There are some common misperceptions about chronic pain. What are some of the common misperceptions that you find common in the general population, but from your background are not necessarily true? And, can you tell us what are the truths about those beliefs?
Yeah, of course. So that's a great question. Number one, I think that, it must be due to something we've seen in an image or something that someone's, told them, it's dangerous. As you know, people always want answers and they want to find a simple answer, sometimes to a complex problem. So often, one of the misconceptions we'll find is, when the people we see have been to different professionals, maybe a chiro or another doctor, obviously when things aren't moving as well, they'll, or moving forward as well as, they want, then, they're further investigated and they may get an MRI or an X-ray or CT scan or something else. And then something is found on that scan and then, oh, well, that's the problem I have. And now I'm being labeled as being deficient in some way. And I think sometimes that mitigates the pathway forward. As Dr. Dave, a lot of times, we can MRI, everybody who's over 80 and we'll find something on their MRI, but that doesn't mean that functionally everyone's impaired. So I think that's one of the main misconceptions. And then further from that is just the hope that they'll get better. I think sometimes people get lost in the system where they're going from person to person to person and just over the course of a year or two or 5 years, they haven't seen the results they want. And so they lose hope that they can get better. And I think that's, a key component in a pathway forward is that, don't lose hope. There is hope to your problem in most cases. And I think it's just finding somebody who's in a situation that understands that, number one, that will take the time to listen to you, and that is knowledgeable in the area of chronic pain and generally, just don't stop until you seek those people out and get help. So.
Yeah, I think that's one of the big things that we see is that who have suffered for years on end and gone from provider to provider, really have kind of given up hope. And, maybe some doctors will even say, there's nothing I can do for you. And they start to hear that and believe that there's nothing that can be done for me, that, it's just easier to believe that, I can't be helped than to risk looking for hope and then getting let down again.
Of course. Yeah.
And so that's a big thing that we see that we have to overcome as well.
Yeah. Yeah. And I think that's the number one key is, there can always be hope. Your body has a great way to heal itself, just given the proper situation and conditions. So, I think, just don't stop until you find somebody who can help you, because there are people out there.
After you go through that thorough kind of initial consultation that you mentioned, where you spend an hour with people, you really kind of find out the drivers of what's going on. What are some of the strategies that you use to help people get relief that maybe are a little bit different from the traditional approach of just medication or ice or stretches or what typical stuff people try?
Yeah, I think it's just finding a combination. There's not one thing that works for everybody. So as I mentioned, I think it just comes with, doing a proper initial assessment and figuring out, are there psychosocial factors involved? What are their beliefs to pain management? What are things that we know in terms of the field using, example like manual therapy or other strategies, different modalities, different exercises, different behavioral modification techniques we can use. So I think it's figuring out that there's not one size that fits all, and figuring out that sometimes in the management of chronic pain, a lot of people can have a combination of mixed pain. So, like example, some people will have, neuropathic pain, which is like pain in your somatosensory system. Or they could just have a one-to-one pain relationship between, an injury, for example. But oftentimes in chronic pain patients, it's a mixed case. So we have to figure out what's sort of the dominant way or the dominant signal that they're facing, and come up with a management plan based on that. But I think a lot of it is again, the psychology of it too, is having those people believe that there's hope, figuring out what are the triggers that are maybe causing their problem, and realizing that it's not just a one-to-one relationship between their injury or even a lack of injury and what they're feeling. And I think that's where, from number one, if we come at it from that perspective, it's just using a combination of different things that will most help most people, and coming up with a management plan. And I think a lot of it too comes with properly communicating along that journey with our clients, in terms of figuring out, is this working? Is it not working? What do you think, is really going on here? And how do you think we can help you best? And I think that's just the main difference between what people will find mostly in the public system, is they don't take that time to really figure out, what's really going on, what are the person's beliefs, and offering them all the options that they have at their disposal.
So, kind of my take on what you just said, and you can correct me if I'm wrong, but, it sounds like, number one, that there's no magic bullet, that you don't do one thing. You don't say, well, I'm a physical therapist, I do exercises, or I'm a chiropractor, I do manipulation, or I'm a massage therapist, I'll massage you to fix your problem, or a medical doctor, I'll prescribe you a medication, or I'm a surgeon, I'll do a surgery to fix your problem. You kind of sort out your treatments based on the individual person. So that's kind of the first thing that I took from it. And then, the other thing is that it sounds like you really work as a team with people. That, it's not, I'm the doctor, I'm a professional, but, it sounds like you take the patient's interest involved, and you work together hand in hand with them to help them get a solution. So is that a fairly decent summary?
Yeah, that's exactly it, Dave. I think that it's, first of all, unrealistic to think that there's one thing that's going to fix, everybody. I think we've gone past that point of realizing that, there's no magic bullet. And I think that's where a lot of people struggle with finding a solution, is we'll just give you a set of exercises and you'll go off and, let me know if if you need my services again. I mean, I think that, with all due respect, that's completely unethical and unprofessional to have that approach, because that just doesn't work. And then the second point is that I think where a lot of people are left and set up for failure is just not making them part of the process, because, people have a say in what help they want. And I think it's realizing that, yes, on our end, we have a level of expertise and professionalism that we can offer our clients, but they're a key part of that piece too, of working as a team to support them and get them better, and offering them solutions that we find are best for them. But I think they need to be a key part of the process.
Very good. Well, Misha, we're kind of running a little short on time here, so kind of to give one or two closing pieces of advice that, if you had to give one or two pieces of information to someone who's suffering with chronic pain, what would those things be?
Yeah, I would say number one, don't lose hope. There's people out there who can help you. There are specialists out there who may have a different approach than what you've seen before, and to not give up hope with them. And I would say the second thing that's super important is, when you're looking for help, don't be afraid to ask many questions. People who don't want to rush you through a certain treatment pathway may be the best option for you. I mean, take the time to ask people, what's your expertise in this area? What can you do that's different than what I've previously done? Are you going to take the time to figure out, the things that I've struggled with, or, the things that I haven't had success with, and what amount of, effort and energy are you going to give to, make sure that, we're going to be able to work properly together, which I think just isn't done enough. And that usually leads to better success, which is really easy to do right up front.
Thank you very much. You do own a practice, and if there's anyone listening in your local area, can you give us a little bit of information just, about how to find your practice, or how to seek out help from an expert in your practice if anyone happens to be listening to this locally?
Yeah, of course. So if anybody in Montreal is interested in this, you can just check out our website. It's Physicentrix, Physicentrix.ca. feel free to set up a free discovery visit. We'll be happy to review, how we can help you and see if we're a good fit for each other. Otherwise, you can also call us at 514-737-7246, and we'd be happy to see how we can help.
Okay. Well, thank you very much, Misha. We'll put all that information in our show notes so that if you didn't catch that live on the call, you can click on the show notes and find out how to get in contact with Misha. And we thank you for listening to the podcast today. Feel free to reach out with any questions. Thanks and have a great day.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.